This conference is for National Cancer Institute, or NCI centers, like the University of Kansas Cancer Center. Kansas City is proud to host this year, and we've got a preview coming up in just a bit. Keeping his life and the lives of others in harmony, how this aspiring local musician, there he is, that's Skippy. This local musician is giving the gift of life. The role he played in creating a special organization to help people and their families during their transplant experience. The Morning Medical Update starts right now. And good morning, everyone. It is Tuesday, April 26th. Thank you so much for being with us here on Facebook, on YouTube, and on Twitter. With more people needing emergency room services, the health system is expanding to accommodate. A little later, we'll tell you about the changes. Coming up in about 15 minutes, Dr. Hawkinson will join us with the latest COVID-19 numbers and headlines, and helping others as they navigate the transplant process. The Kansas City-based organization that is hitting all the right notes thanks to one musician and his family and his very special mama. But first, the 2022 NACCDO-PAMN conference is underway right now at the Marriott in downtown Kansas City. NACCDO stands for the National Association of Cancer Center Development Officers, and PAMN is the acronym for Public Affairs of Marketing Network. A lot of words, and we're going to talk all about it right now. Dr. Roy Jensen, he is the Vice Chancellor and Director of the University of Kansas Cancer Center, and he is joining us live from there now. Good morning, Dr. Jensen. How are you?
Good morning, Jess. How are you?
I am fantastic. Good to see you. So this conference here in Kansas City has kind of been a long time coming as the pandemic kind of derailed it for a time being. But a few years ago, you helped present alongside with the Convention and Visitors Bureau for this conference. Why were you so incredibly passionate about bringing it here to Kansas City?
Well, you know, as we all know, Kansas City is a tremendous town, and we want people to come here and see what we have to offer, and we want to make sure that our cancer center is seen as a leading institution throughout the country. And I think getting the word out is an important part of that, and when you have the convention, you host the convention for the people who are responsible for getting the word out about cancer centers, I think that's a good step for us.
Well, nice work bringing all those folks together here in our great city. So cancer and public affairs communicators and marketers have come together for this annual event, as they do. What is the overall goal for these experts, and how important are their jobs to cancer research and care?
Well, I think as we have been taught a number of lessons from the pandemic about how important communication efforts are. And even when you have the science right, you still have to make sure that you're communicating the right message and tailoring it to your specific audience. And that's really the job of these professionals that come to this meeting. And so we try to share best practices and make sure that we do get our messages out there, because it's absolutely vital. You know, half of all cancers, roughly, can be prevented. And that means that we have an issue around communicating, you know, what is best to improve the health of our public.
So Dr. Jensen, take us behind the scenes a little bit. What will this conference cover the next few days? Anything specific?
You know, I think there's a number of things, and like you have pointed out, this is actually two different sets of professionals coming together, one of which is the marketing and communication folks, and then the other people that are here are the fundraisers for cancer centers across the country. And what they realized is that in many cases those messages overlap, and when people understand how important cancer centers are to the health of a region, then you know, people want to support that and make sure that cancer centers have the adequate resources to do the best possible job that they can.
Dr. Jensen, always good to see you. I will let you go, get back to work, and that crowd behind you.
All righty. It's good to see you guys.
Bye.
Bye-bye.
Bye. Well, it wasn't cancer, but the need for a life-saving organ that inspired one family to help others like them. Luke Harbur was just an infant back in the 90s when doctors said he needed a liver transplant. It was a very long process for his parents, and they turned their experience into a way of helping others going down that same long road.
He was transplanted in 1996, and we started Gift of Life in 98. It's been a long time. 20 years is a long time.
Oh, the liver's not going to be here till 11, 10.
It was terrifying. We knew nothing about transplantation at that time.
Aaron was a perfect match for Luke. We were on a family vacation down on the river in southern Missouri, and we were having a good time. Aaron had asthma, and he also had allergies. So we carried an inhaler with us constantly. He said, hey, I'm having a problem breathing. 45 minutes later, he said, I'm having a problem breathing again. So we got in the car and drove as quick as we could to the local hospital about 25 minutes away.
I really think of Chris and Melody Drake and their family as co-founders, because the spirit of what started it and has perpetuated it came from their gift.
We are so grateful to the Drake family. They dug so deep at a time that was so hard for them to say, we don't want another family to feel this pain. Because they said yes, we all sit here this moment in time.
Their family just said the one word yes in order for me to be alive today. So, I don't know. All I can do is really praise Aaron and thank him a lot for what he's done for me.
When you think about it, you know, we started with a piece of paper, a pencil, and a passion. That's it, and a little bit of cash. We have now grown to 6 employees, 175 volunteers. I think about how all of that has come true based on one word.
Well, Luke and his mom, Kim, join us this morning. Good morning to both of you. What is that one word?
Yes.
Yes. Say yes. What do you mean by that?
So when you're asked, do you want to be a donor at the DMV when you get your driver's license, we want people to think about saying yes. And we also want individuals, unfortunate circumstances happen, you know, and when they happen, sometimes families are in a position for their loved one to be an organ donor, and we hope they say yes to that as well.
I couldn't help but I was just so captivated by that story, seeing all that old footage. What's it like to see you sitting there as a baby on mom's lap and going through this, kind of going back and seeing it in real time?
Well, every time I watch and listen to that footage, being with my family, it makes me emotional in the right kind of way, you know? It makes you realize that as each year goes on, you have to continue to root yourself within a mission and in a passion like Gift of Life does every day. And I'm lucky that my mom's a pretty awesome person. So
yeah, you've said that. I've just been sitting with you for a few moments this morning, and you have really talked about how incredible this woman is sitting right next to you. Another incredible person and family is Aaron. This isn't possible without him. Can you just talk a little bit about what he and what his family has meant to you, Kim?
So we had what's called a directed donation. I owned a dance studio at the time that this all happened in 1996, and one of my dancers' moms went to the church of the Drake family and approached Aaron's family when she knew that he was going to be an organ donor. So we had a special connection at the very beginning. We met Aaron's family. We met his dad about 3 months after transplant. We met his mother about 3 years after transplant, and then Chris, his father, came on our board of directors when we started Gift of Life in 1998.
Well, you mentioned that you were a passionate dancer before
Well,
this.
I don't know about a passionate dancer, but I did have a dance studio for a long time.
Well, I'm sorry, but as I was a dancer too when I was younger, and so when I hear of a woman who had her own dance studio, I'm mesmerized. By the way,
time,
so
yeah.
I'm sure you are. I'm sure she's downplaying it, Luke, as a lot of moms do.
Very humble, very humble.
Very humble. But you have this dance studio. You're going down one path. Along comes Luke, and that takes you down a completely other path. Tell me about that and how you dropped one passion and knew that this was the next direction you had to go.
So after Luke was transplanted in 1996 at Children's Mercy, the transplant team asked me to mentor families at the hospital. And so I did that. And they asked us to come one day and have Nate come along with me, my husband. And when we met with the family, Nate started crying. So when I got into the hallway, I said to him, we're supposed to make people feel better, and maybe this isn't your calling.
Right.
And he turned to me about maybe 3 or 4 days after that and said, I think we should start a nonprofit. And I said, okay. And that's when it all started. So for 6 years, I did Gift of Life during the day, and then in the evenings, I went and did my studio, and I did that for 6 grueling years. And then I I had built my own building. I had employees that worked for me for 20 years. I had a lot of clients, and I sold it all. I sold the contents of the building, and I walked away because my passion had shifted from dancing to organ donation. Isn't that what everybody does in their lifetime? But for me, it was a natural shift.
Yeah, it was a no-brainer. Yeah, a big head spin, but you were right where you were supposed to be. Luke, what has it been like to work with Mom, create this organization, but you also get to say, I lived it, I've been there. How helpful is that when you are talking and working through this with other people and families?
So I think whenever I think about how and why I've been involved in the organization, I did a lot of outreach when I was a kid. I'd go in classrooms with my mom. Naturally, life gets busy, and I haven't been able to do as much work with her. But what amazes me about the mission of Gift of Life is I always get to help volunteer for her. It always helps me understand, like, in the dark times that I might be going through my life, Aaron Drake's gift of life is always what roots me back. And that's what I try to also do through my music. I think it's just really important for people to know that when you go through any kind of dark time, everyone should have and deserves to have a light to go back towards and feel good about. And I know Gift of Life, being with my parents and honestly being with my family and friends, is that for me.
So how has music helped you, Skippy? How has it helped you to, like you said, have that outlet? And was music always, do you go far back and remember music, or has it just been, recently as you've kind of come into your own that you've expressed yourself this way?
That's a fabulous question. I would say music has always been in my life. My mom and my dad first enrolled me in piano when I was 5 years old, did that when I was up to age 10, dabbled in that instrument, and then, as you probably saw through footage, I was doing drum sounds with my mouth, which is called beatboxing.
Oh, I'm sure your mom loved that.
Oh, she loved that at the dinner table all the time.
The dinner table.
But,
lots of spitting.
Yes. And I know for me, beatboxing has actually helped me focus a lot as a person. It's helped me build a lot of confidence. It's its own kind of language, so I've made a lot of friends. I've had some just great funny stories related to it. And I know now music has really helped me as an adult connect with younger people and older people and the messages that I try to tell and try to be as authentic as I possibly can.
And I would add to that so he graduated from high school from the North Carolina School of the Arts, which was a boarding school for drama. And then he said there was too much drama at the drama school. So, okay, doesn't everybody then major in journalism? Isn't that what happens?
That's the transition,
But
yes.
when he went to Ithaca College in upstate New York, he was the beatboxer for their all-male a cappella group.
Yeah.
So he'd always had a lot of
Okay, you left all
music.
those really good,
Yeah,
juicy
yeah.
details out. So you're good. You know what you're
important.
doing.
Yeah, those are big.
Those are big. Okay, so annually, Gift of Life reaches 30,000 students and their families through the Lifesavers program. What is that?
So the Lifesavers program is where we go physically into high schools. We reach about 30,000 individuals a year with that program. That equates to 100 high schools. And we go into biology, we go into science, health, AP psychology, wherever the school wants us to land. And we do a classroom presentation on educating students about the question, do you want to be a donor? So they make an informed decision, and then they share that decision with a loved one. And I think to date we have educated almost 400,000 high school students, and that equates to 600, well, pre-COVID, we were on track to do 600 classroom presentations in a school year. So, that's a lot. I'm tired. That's a lot. And now we trended down a little bit from COVID, but now we're trending back up. I think this year we'll be close to 550 classroom presentations. And we also just got a grant to expand to St. Louis, so we are doing that on the other side of the state. And we've also passed a law that lets us present to school boards across the state of Missouri, so we're presenting to 500 school districts by 2025 about our program.
Fantastic work. So the program centers on one question. What's the one question you ask?
You mean, do you want to be a donor?
Yes. Okay, so that's the question. So you do
that's
incorporate
the golden
that.
nugget question.
Yeah. Do
Yes.
you want to? And what are some of the drawbacks or holdbacks from people, and how do you help them get off the fence with that question?
Well, I think a lot of it is that we're not educated about the question. These students go and they have a love affair for their driver's license. Then they're standing there at the age of 14, 15, 16, 17, and they're asked the question, do you want to be a donor? They do not know the depth and the abundance of that question. And so we're just helping them understand the answer to the question and base it on the right information.
All right, hang tight right there. We're going to do a quick shift over and talk with Dr. Hawkinson, who, Kim, I know you know well because you've watched him throughout
I don't know him, but I'd like to know him.
Well, you'd like to know him. Okay. Well, you're going to get to know him today.
Yeah.
Yes, you have fans in the house, Dr.
Yeah.
Hawkinson. So let's get to our COVID count today.
Yeah. Well, again, current active infections remain under 10. That's good in the single digits. Again, less is much better than more. 9 active infections, 3 in the ICU, none on the ventilator right now, still 17 in that recovery period. And again, around the nation, we know that trends of cases have increased, and so have hospitalizations slightly over this past week. Again, I think most of that is fueled by the Northeast. It still looks like Kansas and Missouri have lower rates of hospitalization compared to last week, but we'll keep our fingers crossed and hopefully just keep people out of the hospital.
Big question, though, that's around is there going to be another surge with this BA2 variant? Any thoughts? Too early to predict? What are you thinking?
I think it's too early to predict. I think we'd be naive to say no, but I think we also have to understand what kind of surge are we talking about? Are we talking about cases? There certainly could be. Will it be as high as the Delta Omicron surge? I hope not. I don't believe it will be. And if we're taking any information from the UK, it seems like they didn't have a increase in their surge in hospitalizations that was consistent with what they had in cases this time. So hopefully that will translate for us into seeing not so many or not a surge in the hospitalizations as we did before.
All right. Well, if you are just joining us now, we are with Luke and Kim Harbur. Both have spent the last, 24 years? That's how long the organization has been around, Kim. Is that right?
Let's call it a long time.
Yeah.
You don't like me to date you.
It's a long time.
You're well into 2 decades, my friend. This is all about their Gift of Life organization that they really have teamed up to do ever since Luke needed a liver transplant when you needed it really soon after he was born, right?
Yeah, I was diagnosed with liver failure at 7 weeks old. Did a lot of things, to try to help him get better. Then he was listed on the national list at 5 months old with 2 years to live without a transplant, and then transplanted at 11 months old.
What was that like to hear the news that you're a new mom?
Oh, it was devastating. I mean, we do have another son. I don't want to leave him out of the story. He's 16 months older than Luke. And it was, honestly, I knew nothing about organ donation. And we're from Kansas City, both my husband and I. And that was one of the reasons why we wanted to, really head up the organization to educate more people. It was a devastating day. I remember it very vividly, December 11th, 1995. And it's hard to hear that your child will die if he doesn't get a transplant. And so I pulled up my bootstraps and decided I was going to be the best mom I could be. And if he passed away, then I had to be at peace that I was the best mom that I could be. My husband struggled with depression at the time, and so we had our hands full.
Yeah, you bring that up. We have happy endings, but it doesn't start out happy,
No.
and the journey to get here is not pretty.
Right.
Luke, you don't remember how you felt all those many years ago, but how do you feel now?
Oh my gosh. Well, I feel spectacular in the sense of I try to live my life knowing every day is a second chance, right? Because without keeping that in mind, without looking towards that light, I think it's very natural to find struggle, right? And what life can bring you every day. But knowing that I have the gift of life makes things a lot more at peace within myself, especially as an adult.
Right. Do you have to continue to do checkups, and you continue to see your physicians regularly,
sure do.
and how often?
Yes. So so first off, I take tacrolimus twice a day, 1.5 milligrams twice a day. And then I also do my lab work every 8 to 12 weeks just to check on my regular levels. And then if there are any particular problem, something that might be problematic in general with my levels, I might do a liver biopsy, and then I just have an annual checkup with Dr. Jody Olson here at the University of Kansas Health System.
And you'll continue to do that? Is that lifelong, some type of monitoring?
I really, it is. And that just is what it is, right? I mean, that's the payoff of having a liver transplant. I'm here.
You'll take it, right? You don't care.
I'll take it. Exactly.
So I want to talk about social media a little bit. Do you think social media has helped get the word out? You talk about, 24 years ago, how things were back then to where they are now. Has it helped as far as creating unique ways for people to connect with donors or at least get the word out, Kim? I'd like to hear from both of you on that.
Well, for living donors, I must say that the social media platform is incredible for living donors, because these poor people are just, it's hard to ask a friend, hey, would you give me a kidney, So the social media aspect for that platform has been tremendous. I do think there's misinformation sometimes in social media. So I think it can be helpful and I think it can be not so helpful. But you're right, it wasn't really around. I mean, wasn't the internet just barely putting up its little head 24 years ago?
Yes.
So it's, it's a way to reach more people.
So it's the good, the bad, and the ugly of social media, as we know. And from both of you, kind of on that same note, how has the organization then changed over the last 24 years? I keep saying that.
Well, we started with a thought.
Okay.
A thought. And, now we've educated 400,000 students. We started a pilot program in 3 high schools, and we've built it to 100 high schools, so there's that. We also have a mentoring program where we match up patients, care partners, living donors, potential transplant recipients with someone who's been on that journey. And we have mentored 850 families from 26 states. So that program has been really is growing and getting more robust. We did not start that program until 2009, so we added that later. And now we're really looking at all of our strategies and kind of what you're saying. Are we reaching everyone in the right way? Does it need to be more edgy? Does it need to be this? Does it need to be that? So we're really good about evaluating as we go. I have a youth advisory board of about 10 high school students because I'm not a teenager anymore. I don't think like a teenager, thank goodness, anymore. But it's important to have their perspective. And so we lean on them when we can.
So, Luke, what's it like when somebody learns that you've had a liver transplant? I'm sure you get a bunch of questions. What are they? How do you navigate those? And how do you use those inquiries, I guess, to help teach and educate?
One of my favorite things about having a liver transplant is actually people barely ask me more questions. It's so funny. I think it's because when people look at me, they don't think I have that going on. When I was a kid, I remember the one instance where my liver transplant really stood out is I was at the pool. I was 4 or 5 years old, and there was some kid that was like, "What's that on your belly?" I was like, "Oh, I had a liver transplant." I just said that. And they're like, "Great!" And then we went swimming. Right? So in a great way, I haven't really been seen as any different. When the question comes up, I get to talk about it. Yeah. And actually, it usually spurs a really great anecdote from that person, whether they've been personally affected or they've never been educated. It actually is an amazing way to start the conversation.
Right. I would imagine. That's what I mean. Just the opportunity to have them ask a question and then maybe you spark something in them to learn more or dig around more or sign up to be a donor. All right, let's talk about something, Skippy. I want to hear a little bit of your music, and then I want to talk to you about that a little bit. So let's roll the footage there. Okay, you're good. Where was this? Where are you doing this?
So I'm doing this at Quixotic Entertainment, which is in Kansas City, right across the street from Kauffman Center for Performing Arts. They had me perform my album release show on Friday, April 8th in their Black Box Theater, and I always thank them for what they did.
Beat Bachman in the Black Box. I love that. Okay, so your album is called My Dying Wish. You quit your job to focus on music, true?
I decided to quit my job to focus on freelance multimedia work and music. So I combined filming, which is what you kind of saw right there, as well as music to sort of make ends meet, right?
So what has that transition like? So you find time, though, to lend lend yourself to Mom's organization, but focus on music?
Primarily, well, you're working all the time, if that's one part of it. I think the other part of it is I am learning what it means to love and appreciate a community that supports you. So, I would be wrong to say that I am not getting help from my amazing parents to give this journey a try. I'm also have these skills in filming and photography to kind of make ends meet as well on top of music. But yeah, I perform probably 2 to 3 times a week across Kansas City, and all of that can be found at musicbyskippy.com. That's where you can kind of see some of my crazy latest projects that have been pent up in my head for the last 5 to 10 years.
And I would like to add to that, his brother, when he graduated from college, turned to us and said, I want to ride my motorcycle around the United States of America alone. And I said, why do you want to do that? He said, because I want to study communities' relationship to kindness and compassion. So he did that. He went on a 4-month bike ride all over the United States of America. So when Luke came to us about this idea, he said, this is my motorcycle ride.
Ooh,
and I thought that was really good, because you can let one kid go around the country, 4 months, and then he went. So you do what you have to do as a
I was thinking, all I heard from you is like, as a mother, to hear my kid wants to jump on a motorcycle.
Oh,
and
yeah,
ride
and
around
it
the
was just a
country.
little one. It wasn't like a fancy one either. It was like,
Scary. I'm thinking, okay, go with the music. We will take the music all
this
day.
is easy.
This is the easy part, right? Bebox
Right.
at the dinner table. So some community questions coming in. Erica wants to know just what has been the scariest part that you remember from the transplant journey? You don't remember the transplant, but just throughout the years, has there been anything that has there been a health scare? Has there been anything that
you can advocate for this, Mom? But I believe we did have one scare of rejection when I was like 5 or 6 years old.
Yeah,
Is
a little
that
bit
right?
older,
You
but
can
right
fact
in
check
there,
me,
yeah.
And that definitely was scary to know as a kid that I might be reliving an episode that I never wanted to remember, if that makes sense. But as I've gotten older, I have honestly not had any more problems, because in a great way, wahoo, I take care of myself.
Right.
That makes a big difference.
Well, okay, I'm going to ask you that question. Yeah, what do you do? Are you super healthy? Do you exercise? You must.
Yeah.
How have you? What do they always say when you get an organ? You're like, you got to really be a good.
To be compliant.
Compliant.
You have to do what you need to do to take care of
Exactly,
that.
and hold on to that organ and take really good care of it. How do you do that?
So the 4 things I can think of off the top of my head take my medication every morning and night. Number 2, I work out actually at this place called 9 Round, which is a kickboxing fitness gym. So I work out there, 3 to 5 times a week just to stay physically healthy. I have two meals a day, sometimes 3. So I kind of do this little kind of slight intermittent fasting that just kind of helps me personally, my food habits. And then also I make sure to get good sleep.
Hard to do.
I know.
How,
so she's a creative person.
Right, exactly.
Yeah.
So Kim, how did COVID did that impact your organization at all?
It
and in
did.
what ways?
We had the mentoring program, because we did actually a lot of mentoring here at KU Hospital System, as well as the other transplant centers in town. So we actually expanded our program nationally now to reach other hospitals with our mentoring program. So that was the good part that came out of something that was kind of complicated. Then we couldn't get into the classroom, so physically, because high schools weren't letting guest speakers in. So we had to go to a virtual platform, and we did that. And now we're trending. Now the teachers are like, hurry up and get here. We can't wait to see you, because they're so tired of virtual learning. So we're now back in person pretty much almost completely. But yeah, we had to shift and learn and do what you need to do to make a program work, and we did.
Just like everyone else did. Okay,
Yeah, we
Dr.
did.
Hawkinson, you're up. Joellen wants to know any trends regarding the hospitalizations that you're seeing, vac status, age, just still kind of a mixed bag of different people in for different reasons?
Yeah, we haven't gone through those recently. Again, we have changed our admission policy as far as all of the inpatients that were coming into the hospital were being screened. Now we're only testing those that are suspected. I don't have any of that information available to me right now about vaccination status, age, comorbidities, or anything like that. We will try to get that and relay that to everybody.
Okay, take a deep breath on this one. So Taylor wants to know, he says, ivermectin is trending this morning on Twitter.
Yeah.
What does Twitter's new ownership, free speech approach mean to COVID? And do you have any concerns about that? And why would it be trending on Twitter?
I haven't delved too much into the Elon Musk and Twitter issue. I know that he is wanting more or less regulations, I guess, for more free speech and more ideas. We know that the employees at Twitter have voiced some concerns because they've tried to put up protections and barriers to not allow that stuff. So I don't really have a lot to say about that itself, but we just know that there has been misinformation going on since the beginning of the COVID pandemic. That will continue. I don't know what ivermectin's trending about. Again, that question has really been laid to rest right now with 2 or 3 very good quality data randomized controlled trials showing that there is absolutely no benefit for protecting against hospitalization and progression to severe disease if you are using ivermectin either to treat COVID-19 or to prevent COVID-19. So I'm just unclear. We know that there are still other platforms that people can go to get misinformation. That is one of the things that we continue to do it here at the health system, is just provide the most accurate, up-to-date, quality information and data to support medicine in all kinds of topics, not only COVID, but all kinds of topics.
You handled that perfectly. Okay, so I want to get to final thoughts, but Kim, I have a comment from Vicki to you. 2 babies, 16 months apart, one with a potentially terminal illness and a husband with depression. Wow. Kim, you're not just the best mom you could be, you're an incredible woman.
Woo-woo!
God bless you and your family.
Agreed.
So how is this experience, before we get to that, just what kind of relationship do you guys have? I bet, do you guys hang? You guys just look like you have so much fun together.
We're pretty cool.
You guys are cool.
I think we're pretty fun. I don't know. We're about to go on a little trip together, aren't we?
We are. My oldest son Cole lives in North Carolina now. So he went to college out there. He's out there, and so we have a Saturday morning 9 a.m. FaceTime, group FaceTime. We do that every Saturday, which is lovely. Mm-hmm. And Luke comes over for dinner almost every Sunday. We are very close, and I think we're kind of cool.
I think we are.
I think so.
I think so.
Like artsy and quirky, and
artsy
it's nice.
Artsy and quirky.
We are artsy. That's true.
Between the dancing and the beatboxing.
Yep.
I think this is pretty cool.
Well, and then my husband's a lawyer, so he keeps it all right there.
He's
man.
like straight edge.
He's like right there.
It's
herding cats.
Yeah, it's a good
herding
balance.
cats.
You gotta have it, though.
I love that. So, final thoughts, Kim. I'll let you get us started. Just what do you want folks to know? How they can access your organization? If they have questions, where they can go?
So our website is giftdonor, giftdonor.org, and that will take you to our website, which has how to register to be an organ donor, as well as information about organ donation, as well as information about our programs. And we certainly want you to come visit us. We want visitors to come and see us.
And you want them to sign up on their driver's
license? We'd like
license.
for them to sign up, and be a registered organ donor, but we really want them to understand the question. Do you want to be a donor? We also do community speaking engagements. So if someone's listening from a company or you have a club that you want us to present to, we are happy to send a speaker. Both our mentoring program and our Lifesavers program is free of charge to the community. So all of our funding is, corporations and individuals and private donors. And we are really proud of the fact that we can do that. There's a great community here.
You may have answered this question, but is driver's license the only way to sign up to be an organ donor?
No, you can go on. You can go on Donate Life, whatever state you live in. Donate Life Missouri, Donate Life Kansas, and it will tell you right there how to register to be an organ donor.
Thank you for all the work you do. So glad to have you.
Thank you.
This is fantastic. Luke, your final thoughts for us today?
Sure. My final thoughts is I do have a full-length album out now. Yes. I will say,
gotta plug it.
Absolutely. And this, all I'm going to say is too, I can't quite talk about too much yet, but this is the first of many big projects happening this year. And the next things that are happening is I've got a talk show actually coming up this Thursday at the Stray Cat Film Center, which is in Kansas City. And then I also have this play and cabaret going on in May. So you can find all of this information about performances, some of the other upcoming music projects at musicbyskippy.com.
We will get that. We will get the word out. I love a good album plug right here on the Morning Medical Update. That's fantastic. So wait, you have a talk show?
Yes, I'm going to be doing a monthly talk show. I've
You
got a
better
3-month...
invite me on.
Yeah, come on over.
I mean, I don't do any. I have no special talents or anything, but I could just sit there.
Broadcasting.
I'd love to have you. Oh,
Great.
Broadcasting. That's a talent.
There was something
Reading
about
the
it. I was like,
teleprompter.
this guy's good. I was like, he might be able to take over. All right,
Oh,
Dr.
geez.
Hawkinson, do you beatbox? Do you dance? What do you do?
want to see it.
Come on, man.
I do all of that, but it's not right for public consumption. But I do it.
All right. What kind of final thoughts can you possibly come
Yeah,
up
I
with?
mean, I'm glad that they're cool. When I tell that I'm cool to my teenage son and daughter, they look at me and tell me that just by saying that means I'm actually not. But in that same vein, with my teenage son, you know, when he filled out his driver's license, he did fill out to be an organ donor. I would encourage everybody, regardless of age, talk with your loved ones.
Yes.
Talk with those people that will be your surrogates,
Yes.
decision makers for those things like end of life decisions, including organ donation. Make your opinions known and your feelings known, so that those people that are making those decisions for you can do the best thing and really adhere to your wishes. So.
Yes.
Fantastic.
Very nice.
Great
that's
ending
awesome.
message. Okay. All right, in headlines this morning, long wait times in the emergency department increased during the pandemic. Now our health system is getting ready for a big expansion that will allow us to help more people in need of critical care. And that involves some traffic changes along East 39th Street. And Alexis Del Cid is outside the ER with more on what you can expect.
Jess, the project begins this week right here at 39th and Cambridge, and in the long run, this will be so much more convenient for you if you need to drop off a loved one here for emergency care, or if you yourself are having an emergency. It also means a larger space for emergency room staff to take care of you. The drop-off area will now be 2 lanes to accommodate 6 cars at a time. The expansion also includes 15 more exam rooms, 4 more trauma and resuscitation rooms, 4 dedicated triage rooms, and 2 more psychiatric service rooms. Chief Operating Officer Chris Reuter also says this is going to ease the pressure on the staff.
I think the expansion of our space inside the ED, increasing the number of treatment rooms and trauma bays, triage spaces, will allow us to access and provide care quicker to patients.
Now in the short run, until this is completed, it's also going to mean a little more congestion in this area. Some of the lanes of traffic will be closed from time to time. There will be times that Reuter says the sidewalk might be closed in this area, and this won't be completed until mid-2024, so it's going to last a while, but in the meantime, the emergency care here will not change. It will be open 24/7, and this is going to be an expansion that is well worth it. Reporting for you, I'm Alexis Del Cid.
And thank you all for being with us today. Don't forget you can catch our shows anytime by logging back on to Facebook, YouTube, and our Twitter pages. Have a great Tuesday. What would you wish for the world? It's a question dozens of artists are answering with paint, canvas, and a brush. On Open Mics with Dr. Stites, we go live to an art show to explain the link between art and healthcare ethics. We'll see you Wednesday at 8 on these social media channels.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.